Violence against doctors and hospitals. What should we do now? How can we stop it permanently? Social Health One Health Movement is conducting a panel discussion. I invite Mr. M.R.Sasi, Social Health One Health Movement, for welcome speech.
Good evening, all. First of all, I would like to thank you all for joining this program in this evening. Today's program is on a specific topic: violence against doctors and hospitals. What should we do now, and how can we stop it permanently? We are aware of the fact that during this pandemic, for the last 2 years, the doctors and paramedical staff are working tirelessly to serve the people across the world. But despite wholehearted service, incidents are often in which doctors and paramedical staff have been attacked. Social Health One Health Movement considers it very serious situation, and the attention of the civil society is to be invited to this issue. That is why we have arranged this program, this panel discussion. This panel discussion is to be inaugurated by Sri M.R. Rajendran Nair, our respected chairman of Social Health One Health Movement, and also a designated senior advocate of High Court of Kerala. Other dignitaries from medical field are participating in this program. Dr. P.K.Sasidharan, former head and professor, General Medicine, Government Medical College, Olarikode. The managing trustee of Social Health One Health Movement. Dr. Haroon M Pillay, consultant neurosurgeon, Medical Trust Hospital, Kochi, also attending this panel discussion. Dr. Vineeth Raj Gopal, assistant professor, Community Medicine and School of Public Health, India, Postgraduate Institute of Medical Education and Research, Chandigarh, is also attending this panel discussion. On behalf of myself and Social Health One Health Movement, I welcome all of you, sirs, to this program. I also welcome Dr. Dona and Dr. Rangarajan and all other participants, all other dignitaries who are on this Zoom platform to attend this panel discussion. Thank you all.
Thank you, sir. Next, I invite Mr. M.R. Rajendran Nair, Senior Advocate, Chairman, Social Health One Health Movement, for inauguration.
Thank you. Welcome to all dignitaries present for this small function. Social Health One Health Movement, as you are already aware of, is an organization striving for complete health of the people. Doctors, lawyers, engineers, architects, and every human being, what they name, are entitled to be members in this organization. We never tolerate violence, especially against doctors, because according to us, doctors are really the guardian angels for protecting the health of not only the individuals, but also the health of the society. Without the society being healthy, no individual can be healthy. That is his thesis promoted by Dr. P.K.Sasidharan. And throwing his toss, we have formed this organization to make people aware of the need for protecting social health. Now, violence against doctors and other medical professionals and against the institutions even is rampant all over India. It is not of a recent origin, as we are all aware. At least by we have got an enactment in Kerala in 2012, and by 2018-19, at least 23 states in India we are having special law to deal with this malady of violation, violence against doctors and medical professionals and the institutions where the treatments are being given. I'm not going into details of the reasons for that. I cannot now suggest the remedies also. Very eminent personalities are available in our panel. They will definitely discuss those matters. They will come out with the reasons. They will come out with the remedies, and we all together will strive to achieve this end. Now, it is a fashion whenever a patient is admitted in a hospital, for no reason also, people get agitated. Sometimes they get agitated for good reasons also. So the question is how we together, human beings together, with a humanistic attitude, promote peace, because peace is the most essential thing for human beings to survive. I am happy that doctor from Brahmakumari's hospital from Mount Abu is present. So I need not carry a cold to Newcastle preaching about the requirement of peace. That is an organization which stands for peace all around, no doubt. Like that, we are peace-loving people. And there is absolutely no dearth of legal provisions to combat this issue. Even without the special enactments which are prevailing in almost all states, special laws, even without that, the ordinary law of Indian Penal Code, the ordinary law of Civil Procedure Code, and the other enactments sufficient enough to get the remedial reliefs. Suppose a doctor is attacked, definitely we can prosecute him, punish him. Definitely we can get a large amount of compensation. But is that what we require? The question is, by compensating for the injury, who is the loser? Perhaps the doctor who loses his health or life will get compensation, therefore his children may survive. But the society will be losing the comfort and control of the medical personnel, which we all need. There may be situations when medical personnel, including doctors, may be erring. There may be cases where the patients may be erring. To meet all these situations, we should have a balanced approach. We should study the problem and we should evolve remedies so that the problem does not survive. We should be, after this discussion, panel discussion, I believe, we should be able to become part of the solution of the problem which you are going to identify. Then social health, One Health movement, of which I am currently the chairman, will be the happiest person. Then I offer further continued discussion and solid action to preserve the social health in the society, to preserve peace in the society, preserve tranquility in the society. And that is our mission, according to me. We are not going to favor this way or that way. There is sufficient room for meaningless people to quarrel. We are not that type of adopting that type of attitude. We have definitely law to our support. But being a lawyer, being a senior lawyer, I always advise take recourse to law only as a last weapon. Humanness, human attitude is required. So that once we convert ourselves to be human beings, perhaps we will be able to find solutions for any problem, and no problem will be there without solution if there is a humanistic approach, honest approach is made. This is what I want to say. With these short words, I'm extremely happy to inaugurate this panel discussion on a very valid current topic, because newspaper around me every day tells the stories of doctors being attacked, institutions being burned, and so many things. This should come to an end. There the court intervention may be needed, police intervention may be needed. Above all, the first and foremost need is our awareness and our preparedness to combat this issue, this social evil, if I may say so. And I welcome you all to give thoughts in that direction. Thank you very much for inviting me for inaugurating. I formally declare this session as open. Thank you.
Thank you, sir. Now we move on to the panel discussion. Our moderator is Dr. Dona C.L, Assistant Insurance Medical Officer, ESI Hospital, Olarikode. Over to you, Dr. Dona.
Thank you, Dr. Nishad, and good afternoon, everyone. Once upon a time, doctors were considered as visible gods. Now we sapiens become civilized. Stone Age has gone, but the current situation is tragical. Health of healthcare professionals, especially doctors in India, are in threat. The gods are beaten as dogs. And this, which in turn stands as a double-edged sword in this society. Anyway, silence is not the answer for violence. Here we have eminent panelists with their voice to the causes and remedies. Let me introduce our eminent speakers. We have Dr. Haroon M Pillay, Consultant Neurosurgeon, Medical Trust Hospital, Kochi. He is also treating patients in Saudi Arabia, UK, Brunei. He has bagged award from Sultan of Brunei for his professional excellence. Apart from his 3 decades of clinical experience, he had several publications in well-reputed journals as well. Welcome, Dr. Haroon M Pillay, sir.
Thank you.
Next, we have Dr. P.K.Sasidharan, currently working as Senior Visiting Consultant at PVS and Aster MIMS, and Emeritus Professor, Department of Family Medicine, Government Medical College, Olarikode. He was former Professor and Head of Department of Medicine and Hematology, Government Medical College, Olarikode, former Dean Faculty of Medicine, University of Calicut, former Chairman, PG Board of Studies, Kuhas, former President of Hypertension Society of India, editorial board member of Indian Journal of Hematology, and founder member of Managing Trustee SHOM. He has authored Doctor's Pocket Companion, Heal Thy India, and various other books on healthcare, and chapters in textbook of medicine and hematology. Welcome, Dr. P.K.Sasidharan, sir. And Dr. Vineeth Raj Gopal, working currently at the Apex Institute, PGI Chandigarh, as Assistant Professor, Family Medicine. He did his MBBS at Government Medical College, Trivandrum, and completed his MD Family Medicine from Government Medical College, Olarikode. He has worked in assistant surgeon and assistant professor in various medical institutions under Government of Kerala. He has authored more than 15 articles, 7 chapters in 2 textbooks, executive editor of the popular general practice textbook, Doctor's Pocket Companion by J.P. Brothers, and editor of Samagra Arogya Samrakshanam, Health Empowerment Series for public by Department of Family Medicine. Welcome, Dr. Vineeth, the history maker, the first MD Family Medicine batch of India.
Thank you, Dr. Dona.
Let us start our session, Violence Against Doctors and Hospitals, How it occurs, what are the remedies? Here we have Dr. Haroon M Pillay. Over to you, sir. We would like
Thank you,
to
Donna.
hear from you, your voice.
Thank you very much. Thank you, Dr. Sasidharan and rest of the team for this wonderful topic. I understand I'm given 10 minutes to present, and then we have later the question answer session. So it's a huge topic and it's a complex topic. So it's very difficult to concise everything in 10 minutes, but I'll just briefly touch upon some salient features. Basically, thing what happened is that the public has lost trust in the medical fraternity. Now, why it happened, how it happened, what can we do about it? That's the whole issue. Now, I have to tell about 4 important things under 4 headings, briefly, how to tackle this. But first of all, it is all preventive. We must focus on preventing violence rather than what happens after violence. Like the honorable lawyer who said that, you know, once an injury happens, once an assault happens, whatever compensation is not going to make up for whatever is lost. So most of my belief on how to solve this is on preventing it. Let me summarize in 4 headings. First of all, education. I'll tell you what it is. It's not educating the doctors. It's not CME. It's educating the public. Education. Number 2 is introspection. We must look into ourselves. The Indian Medical Association must look into the medical fraternity, and the hospital management must look into the system of workflow within the hospital. So we need to do a lot of introspection and weed out whatever is faulty in the system and to have a cleaner image. The third is most important, communication between doctors, patients, and their relatives. And the fourth is documentation, of course. Now, these are the 4 headings with which we have to tackle this. But I'm not going to the details of the last 2, but I would like to tell a few things about the first 2, which is education and introspection. Now, when I say education, I'm educating the public. We need to educate the public about the value of a family physician. This is what I keep on telling everyone. I'm a neurosurgeon. I have patients coming to me straight from their home with a suspicious diagnosis of brain tumor or a disc prolapse or spinal tumor. And then I end up taking history. Whatever history I take, I have in my clinic about 20 minutes to spend with a patient. I can't spend 2 hours with a patient. There is a limit to which you can get full information about the patient within the stipulated time. And then you end up doing some investigations, some scans, and you find nothing is there. Then you refer to the urologist, kidney stones, then the urologist refers him here and there. He feels frustrated. And if you admit him for something that requires genuine treatment, obviously, whatever we explain to the patient or the relatives, they don't understand full of what you explain. Even though they say they understood, they haven't understood. So what they do, they are left with a confused mind and they have nobody to cross-check. So they call their brother-in-law in Kuwait or uncle in Oman and ask for opinion. He may not be a medical professional. And he may give his own expert opinion, or he may refer to some other doctor whom he knows, who may or may not give an opinion without seeing the patient, and the patient and the relative gets more and more confused. So all this can be avoided if the patient has a family physician whom he trusts. So what Indian Medical Association first of all must do is to emphasize to the public that they must identify a doctor near their house or wherever it is whom they have total faith in, and they must approach this doctor for any ailment, whether it be pediatric, gynecology, old age, cardiac, neuro, doesn't matter. This family physician must be their first point of contact. Now, this family physician ideally must be a general practitioner or a general physician or somebody who has done specialization in family medicine. But it's not mandatory. Anybody, even neurosurgeon, orthopedic, doesn't matter. Whoever the family has faith, they must be the family physician. And that family physician will know everything about his patient, his medical history, social history, financial history, psychological history, dietary history. So he's in a better position to understand what's exactly happening to this patient. And either he can treat it or he refers to an appropriate specialty. Now, when he refers to an appropriate specialty or a specialist, the patient may be agreeable to that, or he may say that, okay, I don't want this specialist, I want a different specialist, but doesn't matter. But the specialty is chosen by the family physician. And the family physician gives a referral letter or makes a phone call to the specialist. The specialist has a brief idea about this patient from a medical perspective, rather than taking a detailed history for which he may not get a full idea. And then, suppose I am the specialist, I deal with the patient, I may do some investigations, I may admit him, and I will pick up the phone and call the family physician and explain to him. If I admit the patient, I will explain what I'm going to do. If the patient has any doubt, he will always call the family physician, who will be in a better position to interact. So it's a triangle. This triangle of trust and faith builds trust and takes away all the suspicion and all the unwanted information coming from various sources. So I emphasize step number 1, Indian Medical Association should spend energy and effort in educating the public through radio, television, social media, newspaper, whatever, to have their own family physician and keep that as the primary contact. I tell you, all the confusion will be solved. The other thing, second thing is introspection. I think Indian Medical Association has to do introspection to its members and fraternity. I mean, we are a noble profession, no doubt about it. We all know that. But like any other profession, there are black sheep and some bad reputation. Unfortunately, the news media highlights and exaggerates whatever is happening, and this undermines whatever little trust the public has. Now, the Indian Medical Association must look into this and try to clean up the system if there is anything. I mean, we cannot justify saying that, okay, corruption is there or malpractice is there in everyone. There are only very few black sheep or very little thing. We cannot afford to have even very little things. We should have zero. That's the only way we can solve this. Now, other associations, other professionals, if they have something bad, they have the power or they have the money or they have the manpower to tackle any repercussion from the public. But we medical professionals are not powerful. We are not as united as other trade unions. So it is very important that we have a clean image. Now, the other thing I have to request Indian Medical Association is that Indian Medical Association is an association for the welfare of the medical fraternity. We must focus inward. We must not try to blame Ayurveda or Unani or Siddha Vaidya or Baba Ramdev. That doesn't come under the purview of Indian Medical Association. There are governmental bodies to look into malpractices, false medicines, giving false information. The problem is that once Indian Medical Association gets into these territories which are outside modern medicine and try to fight with them, they have nothing to lose. We have everything to lose. It creates a very bad image among the public mind. The public think that we have something to gain from it. So my suggestion to Indian Medical Association is that we should not get dragged into all those things which are outside the purview of the modern medicine. Now, I would like to quote a Bible, Matthew, in the New Testament, Matthew chapter number 7, verse number 5. It says that, first clean the beam from your eyes before taking the speck from your brother's eyes. So that's what Indian Medical Association must do introspection. Now, Indian Medical Association has to be really powerful. Symbolic protests, asking medical students to hold a placard and standing in the sun that, we are doctors, don't hit us, or wearing a black badge, or canceling the outpatient clinic for a day or an hour. These are symbolic things only having some news value or some curiosity value. This will not translate to results. We must be result oriented. I'll tell you one thing. When I was in Brisbane, I visited a small private hospital, 30-bed hospital. There's a poster there endorsed by the police department. And the picture in the poster is that of a man in a prison. And the wordings are that if you think it is okay to harass a staff in this hospital, either verbally or physically, if you think so, we will give you another 10 years to think. And not only a poster, they do what they mean. Having posters is not enough. We have to do. Now, who has to do? The police and the judiciary have to do, obviously. So the Indian Medical Association has to put pressure on these bodies who are there to help us. So symbolic protests are okay, but don't expect to have results from that. Now, finally, I have to say that because time is running short, every hospital must be encouraged to follow NABH or JCI guidelines. There is no need to go for certification. If a hospital wants to go for certification, it's okay. But going for certification involves a lot of work, a lot of paperwork, many of which are useless. I have worked in so many NABH, JCI hospitals. So I won't say certification helps improve the quality, but there are lots of things within NABH and JCI guidelines which every hospital must adopt for the safety of the patients so that misunderstandings can be relieved. I think I've taken my time. Thank you. I would now move on to the next speaker, if the moderator is okay.
Thank you so much, sir. You have highlighted the both the public aspect as well as the doctor's part, educating the public for the need of family doctors, at the same time looking back to doctors themselves, and the documentation part also you have highlighted. Thank you so much, sir. Next, I call upon Dr. P.K.Sasidharan, sir. Sir, over to you.
I need to share my screen. Can you see?
Sir.
Can you see now?
Yes, sir.
Okay. Thank you all for the good attendance today. People here are genuinely interested people. This is the question we need to answer. Can the strength of doctors' organization fight it? Can we stop by making hospitals as special security zones? Can the physical strength of security personnel there deal with this? Because some doctors have thought of arranging tight security. Will this problem be solved ever by doing these activities? This is the thing which we need to answer. Remember that in the background of the issues we are facing, we need to summarize before we discuss the answers to the questions. Because of several reasons, marginalization, lack of empowerment, lack of awareness, the people are malnourished to the tune of 90 to 98%. 98.5% even do not know what is a balanced diet. So malnutrition is so rampant, and you have all these problems: drinking water, exaggerated consumerist ideas, fast foods, lack of exercise, bad habits, and all these together produce diseases. And unfortunately, doctors are busy with treatment only. They do not get any time to concentrate on addressing the basic issues. So in India, we have a deadly combination of malnutrition and consumerism following the lines of USA. And this deadly combination with overeating, decreased activity, unmanaged stress, and all the bad habits produce all the diseases. It's a package of diseases that we get here. And our health system had been ignoring these basic issues, and actually we are literally manufacturing, because by ignoring it, we are manufacturing the disease, that because we are not addressed it. But remember that diseases are always due to some kind or other kind of marginalization. The marginalization may be in terms of lack of awareness regarding how to prevent it. For example, if somebody gets hypertension or diabetes, it's just because that person did not know how he could have prevented it. Lack of social empowerment is another reason that boils down to social security issues. But people think that diseases are just natural outcome. And they also believe that doctors must be capable of curing any disease when they go to a hospital. But the truth is, the reality is, no patient dies, the patients all die due to their diseases only. or because of the marginalization they have been facing. Some of the problems may be picked up early if they have good family doctors, because family doctors are in a better position to diagnose problems because they know the patient and their background, the surroundings, their habits, everything. They can easily pick up diseases early too. They are also involved in preventing disease and promoting health. And if by chance the diseases have not been picked up and it has gone to manifest fully due to lack of family doctors, it is impossible to save all the patients. Remember that the objective of the medical profession is only three. You cannot cure everyone, cure only sometimes, comfort often by giving antihypertensive or hypoglycemic agents, but you can always console everyone, uh, saying good words. These three are the only objectives of a person sitting in the hospital. But a family doctor has little more to do. But remember, so therefore, remember that no patient here dies due to doctor's negligence or hospital negligence. They die only due to their disease. Look at this picture, probably you might have seen. Saving anyone is a natural instinct. Even animals could be having it, but we can nurture it by training. And suppose this animal is trying to save a person who has been trapped in a swamp. And suppose by chance this animal fails in the attempt, will you say that the animal has killed him? This is a situation when we say a doctor who is trying to save a patient and the patient dies and the people say that the doctor has killed. This is the attitude now that we find. It's very pitiable situation. And with the coming of COVID, all these problems are surfacing, and the attacks on doctors in the hospital I see as a system failure or absence of a system, non-system. And the system failure became, please mute. System failure has become more obvious with the arrival of COVID. In the middle of this double burden and diseases, all these system failure is becoming more. Paradoxically, in a situation where you have double burden and disease, we are encouraging doctor shopping, which Dr. Haroon has already hinted at. People have the freedom to choose doctors for different problems, different organs, different symptoms, and finally they end up doing doctor shopping. And all the social determinants of health is missing here. As a priority, we should have provided to all the sections of people, all these social determinants of health. Health is in fact a manifestation of access to all the social determinants. Humanness is very important. That has to be instilled by primary teachers. We need good primary education. Good lifestyle in all by creating awareness that again needs family doctors and primary teachers with the school health programs. And we need quality food that is possible only with the decentralized integrated farming. We need to promote agriculture also. Safe drinking water through pipes, not boiling water. India probably is one of the very few countries which does not have safe drinking water through public taps. Clean housing, waste management, toilets, and these are issues of architectural issues, environmental engineering, places for exercise, footpaths, cycle paths. These are all issues other departments have to do. See, health is not an issue which doctors have to handle. We come at the last end only. And family doctors definitely have a role in promoting health, wellness, and detecting diseases early. And they are missing in this society. That is another serious issue. So there is a dangerous lack of social determinants of health in this society. Everyone is becoming sick. In one survey, we found that 45% had one or other disease. Only 55% said they don't have any disease, but I'm sure they are waiting for some disease to manifest. And the people are confused with several treatment options. No one to guide them. You have several options, not only different specialists for different organs, you have other systems too. And in this midst, you have, we give a lot of opportunities for philanthropists. They actually use it as an advertisement by donating something or giving some treatment help, and then they advertise it. And then there are people who fish in troubled waters. You might have seen people selling quick fix solutions during COVID. Remember that one thing is very important. even the treatment system can sustain only if you reduce the disease burden. That has not been done in this society. So let us remember that public health, social health is the key to reduce morbidity and mortality, which has been ignored for long in this society. And fortunately for us, the family health centers are coming up in Kerala. The previous government has taken initiative to upgrade all the PHCs as family health centers. It's a progressive movement. But there is another issue. Every person and every family should have family doctors. That's what other countries like Scandinavian countries and UK, Canada, Australia all have it. And these doctors may be living among them to see and seek advice at any time. Patients must be rushed to hospitals only on their advice, except in case of emergencies. Visiting the hospital like or they choose for every organ or every symptom is it's a pitiable state. And the wrong marketing strategies of profit-hungry people is due to the lack of government policies. The most important doctors in the society must be, in fact, family doctors in any progressive society. In fact, UK had been giving more salary to family doctors. It is very difficult to become family doctor in most of these progressive societies. So what led to the attacks? The inflated advertisements on modern amenities in hospitals. When a new hospital is started, they project robotic surgery, this thing, that thing, and they forget to tell about the doctors there. Public health is perceived as facilities for treatment only. Even when the government announces programs for public health, they focus on the technology in the hospital, not on the other aspects. And the health system is often influenced by people with no vision or vested interest because there are no generalist doctors in this society. It's all treatment centered or procedure centered. So even when it comes to social security issues, it ends up distributing money for treatment or buying machines. And that alone is social security in this scenario. And patients go to the hospital with too much expectation. When a patient goes to a hospital, they have the feeling that the doctors are very powerful, very potent, and they must be able to remove my disease. And they go on their own without any referral. And if the doctor is unable to cure, it becomes a problem of the hospital and the doctor. And people's representatives and educated community in this society are guilty. That's what I feel. They fail to it's not the doctors alone. They fail to realize that diseases are caused by marginalization. They have done nothing to remove the marginalization. Even during this COVID time, when I said we should have focused on modifying diet and lifestyle to reduce the impact of the disease. In fact, I was laughed at by doctors and everyone. There has been no advancements in social empowerment, social determinants of health. So the diseases are multiplying and we have double burden, and doctor shopping is encouraged without any curbs. And we focus on setting up state-of-the-art hospital tertiary care alone. Artificially increased need for specialists come because of this. So there is an increased need for specialist doctors because the tertiary care centers are increasing. That's all because the primary care doctors are missing. And the experts who advise the government advise on increasing the number of specialists. In fact, there is one person who advises central government to increase the number of specialist doctors. He doesn't even tell that what we miss is family doctors. The medical education ignores needs of the society. It works only on churning out specialist doctors. The main advisor to the central government keeps on repeating the need for increasing the number of specialists. He doesn't even tell about the need for family doctors in this society. We ignore primary care, imitating USA because USA is a capitalist society. There only people with insurance has treatment, access to treatment. But even that society has 40% of the doctors working as family doctors, but they are in the private sector. We don't have even enough doctors in the private sector. And the final manifestations of all the ills that we see is the attack on the doctors and poor doctors in the hospitals. And the problems begin when there is no opportunity to communicate, or when they fail to communicate, even when they get an opportunity, because many of the time they don't get enough time to communicate even. There is a communication gap always here. But if you had a family doctor, that doctor would have voluntarily taken up that responsibility of communicating. So the attack on hospitals and doctors would continue if we do not set up an army of family doctors all over the country, or if we continue without a referral system, or if we allow the doctor shopping as it is going now. So what are the solutions? There are some hurdles too. Lack of health policy and lack of uniformity in standards of care. One hospital has a different standard, another hospital has another standard. People with more money might go to another place, and some people sell their property to go to a hospital which is advertised as the best in the country. And there is absence of universal insurance coverage, which is there in all the countries which offer universal proper healthcare. Doctors are made to work for money in a society which does not have a proper health policy. Actually, every doctor joins a hospital with the objective of making money. Even I started doing that only because we are not assured the basic minimum facilities when we start working. So we are forced to work for money, and that actually leads some people to end up having wrong attitudes even. Hospitals are built with profit as a driving force, not as a service. And there is a lack of a referral system, and doctor shopping is encouraged. These are the reasons. In fact, one must remember that doctor is a teacher too. It is actually that when we say doctor, it actually refers to family doctors only. In reality, majority of the doctors in any progressive society should be working as family doctors. Canada has it. 80% of the doctors are working as family doctors. Objective of basic medical education is to bring out family doctor. In fact, if you look at the objectives of the MBBS, there are 10 objectives which are very well given. They are all to bring out family doctors only. That's what the society needs, but that's what we have forgotten. So what should we do now? We should have at least temporarily, we should focus on good communication skill, which is absolutely essential when the patient comes. Understanding the feelings of the patient and relatives, we need to have empathy. Medical education has to focus on this basic need, and we need to take time and explain regarding the nature of the illness. Identify some key persons who accompany the patient to explain things, explain regarding the true picture to them, and update them regularly to avoid problems. Explain to the patient also when possible, but never give up hope for recovery when we communicate to the patients. But appropriate language is important, including appropriate body language. Tell that doctors are doing the best that is possible. That is very important. After doing everything, we need to tell them that we are doing everything that is possible. In fact, it is always done. Everyone wants to give the best treatment to their patient. Every doctor, no doctor will spare at any effort to do everything that is possible. But never generate over expectation patients and young medical students by projecting the facilities that we have in the hospital. And we need to stop all unhealthy marketing practices of the hospital owners in terms of in the case of empowerment, awareness. So what should we do in future? Need for 360-degree vision on individual health and public health is very important. Doctors with 360-degree vision are needed in large numbers. And this is possible because the family doctors are the ones who are likely to get it, and general practitioners, general physicians are likely to get it. And if you give training in family practice and if they have the mindset, that vision comes naturally. So they have 360-degree vision on individual health. These are the people, GPs, family doctors, they only acquire it. 360-degree vision on public health, if they have an aptitude, family doctors can get it. But by training, the social and preventive medicine doctors are likely to get it. So these are the two sets of people who should devise plans for the society, not somebody sitting with ventilators or somebody sitting in laboratory. Pulmonologists and cardiologists are not the people to devise plans and strategies for management of public health issues. And it is developed by working with patients only, because that vision is possible only by working with patients. And that too with a 360-degree vision. Or you need to get inputs from the GPs who have 360-degree vision. It's not possible by acquiring a degree in public health or something like that. They only should lead the doctors and MBBS students, that is during medical education, and guide the government to frame policies. But let us come to this point. Do not ignore priorities. Let us create awareness on social determinants of health. These are our priorities always, but these have been neglected. Malnutrition, number one enemy. unsafe drinking water, poor hygiene, accumulating waste. We still ignore it. Unchecked consumerism. We are following USA to promote it here. So let us reduce the disease burden by providing balanced diet for all, clean and safe environment, safe drinking water, shelter, good primary education, large number of primary care doctors. This is also a social determinant of health. Create awareness and empowerment for good lifestyle habits. Again, we need family doctors for that. So that is why we started this movement called Social Health, One Health movement. All are issues of social security and human development. So these are the solutions in a nutshell. Good primary education to all to transform every individual into good human beings, because humanness is a background of healthy society. Nurturing humanness is a prerequisite. Making primary school teaching as the most respectful job. The Scandinavian countries have already done it. In fact, Finland gives more salary to them to ensure family doctors for all houses, all individuals. Health policy, which is people-centered, not doctor-centered. And health system and policy should not be doctor-centered, that we have to take special care to avoid it. Large number of primary care doctors. I would say we need to have at least 80% of doctors in the society should be working as family doctors. Do not instill fear of disease. That is against medical ethics. If you frighten people in the name of disease, it is actually against medical ethics. Over expectation should not be generated also. That's also against medical ethics. We need to have a referral system. Each medical college should have family medicine department. But the government was very quick in starting emergency medicine. They should have taken given more importance to family medicine. And we should provide increased career opportunities for family doctors. Some doctors are asking, what is the point in taking family medicine? Because even the government has not given any priority for them. So we should aim at a situation where MBBS seats are equal to PG seats. There are 85,000 MBBS seats, only 25,000 PG seats. 55,000 MBBS students are wasting their time. In fact, all of them are wasting their time focusing on entrance exam for these 25,000 seats. So why are we wasting that whole energy? We need to change the whole scenario. So doctors organizations like IMA should strike for starting family medicine departments in all the colleges, start family medicine training in all the major hospitals, including district hospitals, and the doctors in PHC, CHC should be trained in family medicine. I am very much upset when I see, because even now, every day I'm getting this feedback. People sitting in PHCs and all are waiting for an opportunity to go for a PG course. They don't want to stay back there. So if you train them in family medicine, that will not happen. And government should have give more salary and priority to family doctors. Then only it is going to materialize. Bring laws, only those referred patients or patients referred by family doctors should reach tertiary care centers. All these are important to solve the problems. And the health system should be running completely under government guideline. Even if you have private hospitals, there must be a single law controlling all the hospitals. I don't say you should nationalize all of them, but maintaining the private hospitals, including, we should have a uniform code of conduct for all the hospitals and universal health insurance to meet hospital expenses. But we should we should not follow USA model. USA, 5 crores of people do not have any treatment options because they do not take anyone without insurance. And poor people have no way of getting treatment in USA. That should not be the model for us. Treatment facilities should be uniform in standards at every layer. The primary care, everywhere it should be the same. Secondary care, everywhere it should be the same. Tertiary care, it should be the same in every hospital. And people should be made to accept realities. If we get sick, we and the society are responsible, not the doctors. Doctors won't be able to cure everyone. Hospitals and doctors will do everything possible to save the patient. Even the some hospitals which are identified as cutthroat hospitals, even they will do everything possible to save the patient because that is their bread and butter. They will do everything possible. Then how can they attack doctors in hospital when a patient dies? So what in future? Medical degrees only for those with aptitude, not for making money. No more medical degrees with capitation fees. Medical colleges and hospitals should not be business ventures. They should be made with the money. They should not be made with business motive. And hospitals should be started with money kept apart as a service to the people. There should not be an intention to recover the money spent on the hospital building or the land of the hospital, and the salary and allowances doctors to be made uniform, irrespective of the specialty. The family doctors and specialists should be getting the same salary with a uniform pattern. And all doctors, hospitals should be working for the government. It is not an utopian idea. Without this, we are not going to achieve anything. This will end unethical marketing and the doctor shopping. IMA should be controlled by generalist doctors rather than specialists because they do not have the vision for the people. Government should consult generalists only for policy making. Determination by governments to ward off vested interest. That's very important because they should identify people with vested interest advising on policy changes. This is what is happening. Lack of 360-degree vision on individual health and public health. That is possible only with the GPs and family doctors, and the SPM doctors can now it on public health. They might interpret with their own attitude and aptitude, and they forget to see the real elephant in the picture. This is what we need finally. Let us build a stable health pyramid. Let us provide social determinants of health to every individual in the society. That will reduce the disease burden. Then we need large number of family doctors sitting in all the primary health centers. They can be in the private also till we have a streamlined plan. And then we need general hospitals and diminishing importance only to the specialty hospitals. This health pyramid is very important to solve this problem. Thank you. If I will answer to the questions later after completing the presentations.
Thank you, sir. Sir was pointed out how a person become a patient. Majority of disease due to wrong lifestyle and diet. The patient himself is responsible or lack of social security or lack of knowledge. And he has also pointed out the social aspect of a disease and pointed about the need of large number of family doctors as well. Thank you, sir. We will come to you back. Now I welcome Dr. Vineeth Raj Gopal. Please, we would like to hear from you.
Good evening, all. Because of a low bandwidth, I'm keeping my camera off. So thank you, SHOM, for the invitation. Agreeing with the panelists for the reasons suggested, but I believe that this is a composite group. So let me add upon some practical reasons faced by practicing doctors in various levels. So that this is a general consensus that the violence against doctors and hospital establishment is multi-layered. But I believe that the crux of the whole problem is a lack of proper communication, as suggested by Dr. Pillay. So when we trace upon the incidents, in majority of these incidents, it is due to the improper patient-doctor communication. The patients and the attendants, they depend on the treating physician to give them accurate and honest information about the cause of the disease process, the options for investigations and treatment. Then again, the in-hospital course and prognosis, and the cost which is involved in the management. So when this information is not adequately communicated to the patient in some situations or to the bystanders in another scenarios, that can lead to misunderstandings, then miscommunication, and of course mishappenings. Then again, the second problem is that when we think from the patient or from the attendant side, the patient and their attendants are in a most vulnerable phase of their existence. They are facing maybe temporary or permanent disability or even death. So in this state of mind, they'll be fearful, anxious, and of course in doubt. So here what they require is empathy and humane behavior, as suggested by Dr. Sasidharan, and not challenge from the doctor and the healthcare staff. And there are the other practical, which is, of course, it is managerial issues. Like it is different for different kind of settings. For primary care of healthcare setting, it is different. For tertiary care, that may be different. But of course, they are related to both behavioral, then socio-political and administrative reasons. So some of those reasons are long waiting period before the patient could speak to the doctor, or feeling that the doctor is not giving enough attention to his patients, perceived lack of availability of a doctor or maybe a senior doctor, then poor quality of emergency care, which can also be perceived, the non-availability of crucial investigations, inordinate delay in referrals, unfavorable or extremely crowded OPs and other emergency wards or OP settings, and lack of proper grievances redressal mechanism. Again, we have some socio-political and administrative reasons like high workload in public sector institutions, inadequate infrastructures, lack of civil responsibility, political interferences, the negative image of doctors, which is portrayed by the media, and pseudo assurances from healthcare institutions, and lack of a proper security and surveillance system. Again, Dr. Haroon pointed out a current scenario. This is due to the current intellectual social class scenario. So I'm also supporting that reason. It is the casual opinion. The criticism by the second opinion or by other doctors during further consultations. And there is a worse scenario, which is already explained. A friend who calls you and asks you that if Dr. X is giving him the right treatment or the right treatment to his relative, and he will forward a list of investigations. So being in a societal norms, the doctor gives right, left, and other advices, which can harm the credibility of the community. So always second opinion should be given very carefully, even if it is doctors or other professionals, with careful choice of words. So consolidating all this practical issues, what the medical students and doctors should do. We have the MNC, which is already taken some steps for revising the MBBS and MD curriculum. So changing the curriculum of study, developing some more communication skills, then understanding by taking note of patient's relative who can be violent. So these are all sounds like impractical solutions, but these are the suggested solutions to be done by the medical students and from the doctor's part. Then being cautious at violent venues, educating patients and their relatives. The MNC is suggesting the not the classic patient doctor.
Excuse me, Dr. Vineeth, please.
Yes.
It is not audible.
Okay.
But I'm hearing it.
Vineeth.
Okay, so I'll be a little more louder.
Also hearing Dr.
Yes,
Vineeth.
yes.
Okay, okay. So the MNC is suggesting not the conventional doctor-patient relationship, and that doesn't no longer works. Now it has been changed to a participatory approach, and it has to be effectively communicated that doctors cannot perform miracles. Indeed, they can modify disease process, but they cannot prevent eventual mortality. So this is from the part of doctors, and what the hospital should do. These are all practical guidelines in order to prevent attack to hospital establishment. So hospitals, they can take some steps to improve the services to a competent fashion. Then employment of, these are all administrative and managerial issues, employment of adequate number of doctors and staff, then use of electronic hospital management system. Hospital security should be strengthened, and no one without a proper ID should be entered into the hospital. Then restrict the bystanders for normal and for emergency situations. Then there should be a transparency on rates of different investigations, rents, and other expenses in the hospital. For drunk mischief makers, they should be filtered in emergency rooms by breath analyzers, and there should be a proper complaint redressal mechanism. And all those prescriptions, some are implementable and some are obviously not. Of course, the society, the family and society at large, they can also take some steps to prevent the violence. Those are all related to the civic sense, which is to be imparted during the school days. Then the media should also take the responsibility of not defaming any doctors without getting enough evidences from a proper source. So these are some of those practical suggestions, which has already been stated by various agencies, and we have recently we have some hospital and hospital establishment bills. I think there are advocates in the panel. They can throw some light during this issues and give some clarity in these bills. So with that, the topic is open for discussion. Being a composite group, we can get further information and further suggestion from the panel. Thank you.
Thank you, Dr. Vineeth. He was pointing about the doctor-patient relationship improvement and the role of media in this scenario, especially as ethics of journalism is to be practiced, and doctors are to modify disease, and this hospitals also has to come up with certain policies. And here we have some questions. First question is to you, Dr. Vineeth. Defaming comments from doctors, health professionals about other doctors or staff and hospitals will backfire the doctor fraternity. Is that to the reason, sir? Question is to Dr. Vineeth, please.
Hello.
Dr. Vineeth.
Dr. Vineeth.
Okay, I got the question, Dr. Dona. So I believe that the responsibility of media, both print, electronic, and social medias. So during the last some years, we are seeing some sensational news, and the media, because they are handling the issues, if at all they get some anti-establishment issues, they will sensitize the issue, and they should also be being public, being a normal human being or being non-medicos. They should also be taught that medicine is not a black and white subject, and management, the medical management is not like a hypothetical deductive process, and always newer evidences or newer medicine, newer investigations and newer knowledge, which will not help in every scenario is different. That should be properly taught to the medias, and without getting evidences, because this is a kind of patient doctor, that is a public health approach, or every day you're meeting patients. So defaming a doctor is not like defaming some teacher. Maybe teachers can pardon me. A teacher of who's teaching pure science. So there is a larger responsibility of the media in order to prevent such vandalization or sensational news.
Vineeth, it seems not only media, the doctors themselves are putting blame. Gynecologists put blame on pediatricians. Pediatricians put blame on gynecologists. Or one doctor from this hospital blame other hospital doctor. We were asking about that. Is that too the reason?
Yes, I do agree, and Dr. Haroon already stated this thing. So, giving a second opinion, doctors should always be very careful without having proper evidences or without having a prudent diagnosis, which is separate, which is totally different from the primary diagnosis. You should not comment anything. And if at all you properly believe that the doctor who's given treatment for the patient that obscured or that created some harm for the patient, then the doctor can opine in that way. Otherwise, don't give any casual responses in case of a medical diagnosis and management.
Yes, if anyone can commit mistakes, if that mistakes happen, better a doctor can communicate with the doctor and the mistake will never repeat. Instead of putting unnecessary comments and sometimes may not be true. So that should not be encouraged.
Yes, yes.
Thank you, Dr. Vineeth. Next is to Dr. Haroon. Sir, you were telling about the need of family doctors. If we promote large number of family doctors, will the other doctors will become jobless? Or which it will...
The other doctors means who? As a neurosurgeon, I will not become jobless if family doctors come.
Or will they help other doctors? What is your view, sir?
I don't understand. Will they help other doctors means what?
This family doctors, if we increase the number of family doctors are here to teach this society to prevent disease, about the better lifestyle and diet, so that the disease burden will be less. Will the doctor community will suffer because of this family?
No. I think you get confused, Dr. Mona. By family physician, I don't mean a primary care doctor. A primary care doctor is the one that is supposed to teach about vaccination, health, hygiene, food, you know, the preventable diseases. But preventable diseases are not the significant number of diseases. For example, brain tumor, you cannot prevent. Subarachnoid hemorrhage, I mean, all the cases that I come across, they don't come under the preventable category. So I think you should differentiate between a primary health physician versus a family doctor. When I say a family doctor, I don't mean a general practitioner or a general physician or a family physician. These or a family medicine specialist. I mean, these are preferable, but any family can have any doctor from the modern medicine. Let it be neurosurgeon. If a family has trust in me, they come to me for everything, including their child, their mother, their wife, their bone, their heart, anything. Until I say, sorry, I don't know, you go to some other doctor. So long as they have a trust in a doctor, they must go to this doctor for every primary problem. And this doctor will tell them, I think your problem is cardiac, you go to a cardiology. Okay, so specialty is decided. Now comes the specialist and the hospital. Somebody has raised a point I saw in the chat box that how about the family physician referring to his favorite doctor? Okay, if a family physician says that, okay, I think you have a neurosurgical problem, go to Dr. Haroon. And the patient says that, no, I don't like him, he's useless. Okay, then the family physicians can say, okay, fine. So who do you want as a neurosurgeon? So they will say, okay, I want this other doctor as neurosurgeon. Then the family doctor can say, yeah, he's not bad, you can go. Or he may say that, oh no, why not we try this one? So anyway, they both come to a decision as to who he goes to. But the speciality, not the specialist, not the hospital, the speciality this patient must go will be decided by the family doctor, not the primary care physician, the family doctor. So thereby, the patient goes to the appropriate specialty rather than hunting around and going around in circles. That's what I'm saying.
Okay, thank you, sir. Thank you so much. Next is to Dr. P.K.Sasidharan, sir. Health is commercialized. Is that too the reason for this violence? Increasing advertisements and the rest regarding the commercialization. How can we rectify this, sir?
That is why I was referring to system failure or a non-system as an issue behind the whole problem. So commercialization of health profession itself is a real reason for all these problems. Health should not be a commercial issue. It should be strictly under government guidance and government control. That's why I said about dreaming of a uniform pattern, uniform facilities across the section, across the different layers of the hospitals, and that alone can solve it. The hospital should not advertise making big claims that you have this thing, that thing in the hospital, and patients should not be going there because of high expectations about cure. They should be directed properly by family doctors. And Dr. Haroon suggested about making anyone as family doctor. He says stopgap arrangement till we have enough family doctors. It's not a permanent solution. For India, that is a solution at the moment because we don't have any family doctors. We need to bring out a large number of family doctors. There is a potential for it. 55,000 MBBS students are wasting their time and money and everything, and a skill also. So we need to channelize all of them into family practice. It is possible. We can give training for them in the district hospitals and all the major hospitals. We can give them training for 3 years to make them competent to do their job as family doctors, and then deploy them to the PHCs, CHCs, and gradually in over another 5 years, probably we can fill up this big lacune of absence of family doctors. What Dr. Haroon said is a stopgap arrangement only till we have enough family doctors. We should aim at having enough family doctors. And there was a comment in the chat box that that there is no negligence from doctor's side. Somebody disagreed with my comment. I didn't mean that there is absolutely no negligence, but it is not the negligence that leads to problems here. It is due to lack of communication. Negligence can occur in any individual, in any profession, in any activity, but negligence also is not purposeful. So the negligence is there, that is a minor point only, but most of it is exaggerated. You should not give opinion on a patient who is staying in another hospital. Unless you are in charge of the patient, you are not supposed to give opinion. Several patients come to me with their reports asking for opinion. I will say, unless I see the patient, I will never tell you anything about the patient's problem. That should be the attitude. Never give comments on patients under somebody else's care. Unless the patient is with you, you should not give comment on the patient's prognosis. That is what we should follow.
Okay, sir, thank you. Sir, next question is to Dr. Haroon. Sir, many times verbal abuse, which is also a form of violence, comes from the politicians who have vested interest, who hinder proper working of doctors. How can this be dealt with?
Yeah, definitely. I think I answered this earlier, because as doctors, we cannot stop. Politicians are united. They have people following them to die, to kill. We are not united. So there's no way we can stop a politician from verbal or physical abuse. That is why I said Indian Medical Association should use its muscle power to twist the arm of the police and judiciary to make sure any form of verbal or physical abuse by anyone against any staff in the hospital will lead to at least 5 years imprisonment, if not more. I told the example of the poster in a hospital in Brisbane. I mean, we must do that. And unfortunately, let's face the reality. Unfortunately, we are a corrupt society. The police is under the politicians. So we have problems here. But whatever it is said and done, we cannot stop anyone from hitting us. We cannot stop anyone from verbally abusing us if they want to. But by following the education, the introspection, the communication, and the documentation. I need about 1.5 hours to talk about it. If we follow all that things, and Indian Medical Association makes sure every doctor tries to follow this, we can reduce this violence to a certain extent. There's no way we can stop this because we are a corrupt society. Everybody is using their muscle power. Politicians, recently a policeman hit a doctor, I heard. So, you know, so unfortunately, these things are unheard of in other countries. But at least we can reduce to a significant amount if we focus on these things. Education, introspection, communication, documentation. This is a vast topic. Communication is a huge topic by itself.
Thank you, sir. Sir, next is to Dr. Vineeth. This strong implementation of law and order. There is no strong implementation of law and order if someone manhandle a doctor or hospital. Is that the only reason for this current violence? How can we prevent?
No, no, we have strong laws, but unfortunately, a law and order which acts very slow. But we have definitely we have IPC sections. Then we have the Health Service Personnel and Clinical Establishment Bill, which is for the prohibition of violence and damage of property. So we have all this, and recently the Indian Epidemic Act. All these are very strong laws. But as Dr. Pillay, Haroon Pillay suggested, we have something like we need to enforce this laws, but unfortunately, the law and order, which is not happening very slowly, especially if it is a case of a doctor. So we know most government hospitals in India, they lack adequate security personnel. And during late night hours, this is a practical problem. The medical officer even play the role of doctor and security personnel, the security guard. And there is no established protocol for tracking all these violences. And as Sir said, the police forces, it is being plagued by these politicians. So hence relying on police for safety, it is also impractical. But anyway, we have all this strong law, which is to be implemented willfully, and that is to be compelled by IMA and other doctors organizations, so that further this attacks to be prevented. So that's all, Dr. Dona.
Can I add some more to that? Dr.
Yes,
Dona,
yes.
is that allowed?
Yes, yes.
Yes, sir. Yes, sir.
Okay, like Dr. Vineeth was telling, you know, having a law is not enough. It carries only the value of a paper. Enforcing the law is important. Like, for example, we have IPC 279 to arrest anyone who is doing rash and negligent driving on the roads, but zero implementation. So having a law is not enough. People are not implementing. That's why I said, as a solution, Indian Medical Association should flex its muscles. Indian Medical Association should not waste its time asking medical students to stand in the sun holding placards saying that we are poor doctors, don't hit us, wear black badges. These things, they can only take photograph and publish in their annual report and send it to the high command. It is not going to make any difference. Let's be result oriented. If we cannot do things result oriented, we are not going to find results. I'm a surgeon, that's what I'm saying. Whatever we do, we focus on result oriented. We don't dilly-dally and do things for the sake of doing. If you want to do something, do result oriented. Otherwise, be a Mahatma Gandhi and show the other side of the cheek. Simple.
What do you suggest for that? For example,
Indian
IMA.
Medical Association should flex its muscle. I don't know how it can be done, but they have to develop. They have to develop and use force again, whatever way, psychological, whatever way, on the police and the judiciary to make sure that no verbal or physical assault in the hospital will be tolerated. It will lead to immediate arrest and implementation of punishment, 2 years, 5 years, 10 years imprisonment, whatever it is. But if somebody gets into violence, like somebody said, a politician or a policeman or somebody, and the rule says, okay, he can be arrested, and the police or somebody arrests, and the area president or the secretary calls from his party office and the police releases him, what are we doing? I mean, we cannot change the system. At least the Indian Medical Association should spend its energy and time trying to pressurize the law enforcing authorities to implement the law. They may succeed, they may not succeed, but that is where they should channel all their energy to, instead of going after Baba Ramdev and Ayurveda. That is a waste, and that brings bad reputation to a profession. People feel envious, people feel angry with us, people feel that we are into selfish business. They say, you are a neurosurgeon, why don't you mind your own business? Why are you worried about this Ayurveda thing? That is what I'm saying. Indian Medical Association should change its priorities.
It's a very good suggestion from you, sir. But the Indian Medical Association is actually, like you said, is not going in the proper way. As you said, it should be result oriented. But how to go about it? Being a very small community of around in Kerala, around 30 or 35,000 doctors. How can you influence them?
I think
what is the way forward?
I don't know.
Big question, sir.
In 2 minutes' time, I am not that intelligent to come out with a solution, but the IMA think tank should sit and meet and discuss and try and do it. They have to find out with a solution. Otherwise, we will still be abused and physically assaulted by people, believe me. Wearing a black badge, how many times we have worn a black badge? How many times we have boycotted outpatient clinic? Has that made any difference? Why are we doing it again and again? You know, Albert Einstein once said, I think it's Thomas Edison said, he said, if you do something and you get a particular result, you do the same thing again and again, you get only the same result. If you want a different result, you have to do things different. Every time there is an assault, we boycott outpatient clinic for 1 day. Oh, big deal. What happens? Next day, somebody is assaulted, 1 hour boycott. Next day, somebody assaulted, students standing with placard.
We fully agree with that. We completely agree with that.
If we do something, focus on result. If we cannot think of result-oriented behaviors, let's not do anything. Let's accept it. But let's not do this comedy and tragedy thing, you know, showing off. That's what I'm telling. Indian Medical Association should flex its muscles and focus and think and pressurize.
Hello.
Thank you, sir.
There was
P.K. sir.
There is one question that family physician concept will be more practical in UK and other developed countries. That shows our negative attitudes to the health system. This country needs more number of family physicians than any other country. It is just because we don't have a policy, we don't have it. It's not correct to say that it is not possible in India. If it is not possible in India, I will say let us suffer silently and get more abuse and attacks. We have to come out with the solutions. Like as Dr. Haroon said, wearing a black badge is not the solution. We need to come out with policy changes, and we need to work for policy changes. IMA, KGMOA should strike for starting family medicine departments in all the medical colleges and facilities for training in family medicine in all the district hospitals and major general hospitals, whether it is private or government. Let us train all the PGs who do not get a PG seat to become family doctors. And it is very easy. Let them offer more salary or at least equal salary. Nothing, it will change. In England, they give more salary to the GPs. Recently, I don't know whether there is some change. Otherwise, in all the countries, it is very difficult to become a good GP or a family doctor. Why are we closing our eyes on family doctors in this country? It is possible, it should be possible. If it is not possible, like the Women's Commission chairperson said, let us suffer. That must be the attitude.
Thank you, sir. Sir, one more question. Mostly the emotional outbreak due to unforeseen news like complication or unexpected expense. First one is to be managed by proper communication while consenting and even require a security team. And for the second issue, assurance to the patient is by compulsory health insurance. Dr. P.K.Sasidharan sir, what is your advice regarding this? How, as a clinician for past 3 decades, how you manage this unexpected scenario when we met with the patient care?
No, I didn't get the question carefully, clearly. What was the question?
Sir, main reasons for doctors being attacked are the emotional breakout due to the unforeseen news, like unforeseen complication or unexpected death. How can we convince these patients?
Sometimes, very rarely, it is something beyond our control. I remember one patient who came in the early morning at 5 o'clock in the morning, and by 8 o'clock the patient came walking to the ward. At 8 a.m. the patient died. And when the house surgeon, who was it was his first posting after completing MBBS, who went there and found that the patient was apparently he was sleeping, and he approached the bed and examined the patient and immediately pronounced, "Ayo, marichu poi." The patient, he said, he got upset and said the patient died. There was only 3 hours in the hospital, and immediately the bystander caught his collar as if to hit him. This is a reaction which naturally would happen because no explanation, nothing has been completed in between. Actually, that situation needs some special care. It was an unfortunate, rare incident. It cannot happen always. So such situations can happen very rarely, but that is not what we should base on planning things. We should plan things on which are likely to happen. Even if a patient dies suddenly, the patient would have been there with us for some time. We should start briefing the responsible bystander. We need to identify one bystander who is genuinely responsible, not the leader of the team who accompanies. We need to identify which person is genuinely more important in handling. That person should be briefed every time when regarding the progress or deterioration. And once they are briefed about the condition, if you have a person referring the patient to the hospital, nothing will happen. They will do that job. Nothing will happen. That is why the importance of family doctors. Anyway, even otherwise, let us communicate properly after doing everything for the patient. That should be done positively, and nothing will happen because death is a natural event only. In fact, I don't think no patient dies due to negligence alone. Negligence is only extremely rare. Even that is not a willful negligence. It's not something like a crime. This is something which we should know.
Thank you, sir.
Dr. Vijay Kumar.
Yes. I want Dr. P.K. and Dr. Vijay Kumar from Pandalam. Actually, I want to. Hello?
Hello, please.
I want to ask one a small part of the discussions. Actually, one is that when I see a prescription by another doctor, a patient is coming to me for the first time, for example, for a diabetic patient, and I'm seeing a drug which is totally unacceptable to that patient, should not be given to that patient according to me and according to the circumstances, to my knowledge. I have to strike that and give another prescription for that particular patient. How can I communicate back to that to the previous doctor? Because I have burned my finger on 2 or 3 times when I send back when I try to call the patient doctor back, they do not take it in a right way. Actually, totally unacceptable. For example, pioglitazone in high dose given to a cardiac patient with impending failure. So I had to strike that prescription. But how can I communicate with the previous doctor? Not a comment to the physician, and how can I do it nicely, and so that it should not be repeated?
I think I will answer that. If I come across a situation like that, what I do is I will never tell that this drug is not needed in that particular situation. Instead, I will tell the patient about something else and change the prescription very gently without making any suspicion regarding the error that the previous doctor has made. So that way I will change the prescription, and later on I will either keep quiet or call the doctor personally and tell that this has happened. Please take care of. If there is a good rapport with that doctor. If not, then we can ignore it. That's all we can do.
Yeah, if the first part I totally agree. I also do the same thing. But when I wanted to communicate with the doctor directly, some of them did not take it in the right way. So
That is
education.
true. That is true.
There appears to be a question to me, Dr. Dona.
Yes, sir.
Somebody, Mr. Shaju Mathan, I think,
Yes,
has a question regarding the bail
sir.
granted to the.
Yes, there is a question. Sir,
that
you might have read the Mavelikara issue where a law protector slapped a duty doctor even as his mother was brought dead, and the guilty person's bail verdict took 2 weeks. My question is, this bail verdict was given by a single judge. Can this
Yes.
can
And this
again a doctor can again appeal to High Court, separate bench?
in a bail matter, when a single judge of the High Court gives a verdict, there is no appeal to two judge bench. They can go only to Supreme Court. If the grant of bail is objected to, they should go to the Supreme Court. If it is done by sessions judge, district judge, of course, they can come to High Court. I don't know the facts of the case. Of course, newspaper reports, I have also seen some policemen slapping. Is it like that, Mr. Raju Mathan? Policeman.
Yes, sir. Yes, sir. His mother, the policeman's mother was brought dead,
Yes.
and the doctor on duty attended to the patient along with the sisters, and there was no heartbeat or respiration. So he declared it dead. After 3 hours,
she was brought dead.
Yeah.
Brought dead. I have seen.
Yeah.
And then after getting the slap on the cheek, doctors went on strike. Protest was there.
But that time the son was not there. It happened at 4 o'clock. The son, a police officer, came at 7:30 in the morning.
Yes.
With some other people, and then slapped. That was an intent.
Anyway, there was a calculated attempt to harm the doctor. I told you initially itself. In fact, we have got a 2012 enactment in Kerala specifically dealing with the situation where the offender is punishable with 3 years imprisonment, because giving a slap on the cheek by hand is otherwise it's a lesser offense in the IPC. But in the Kerala Healthcare Services Persons and Healthcare Institutions Preventing Violence and Damage to Property Act 2012, Section 3 makes any such offense punishable, violation of Section 3. And the punishment is 3 years and 50,000 rupees fine. I don't know whether the case is initiated under this section or not, but it's a graver offense when a professional doctor who has performed his duty is given a slap on his cheek only for the reason that what was brought before him was the person who was already dead. So this is the purpose of such special enactments are there. Professional security, working security must be there, not only for doctors, all those who are connected with the hospital. And even for lawyers, sometimes this happens when a case is lost before a judge. Suppose the clients come in crowd, because sometimes maybe a politically charged situation may be there. If the lawyer's office is attacked, no special law for that. But I think the bail is only by single judge in the High Court. Above that, only the Supreme Court as at present.
Another question, sir. Small question. Can a bail plea, does it take 2 weeks for the verdict?
That, of course, bail, it takes time because the court will adjourn the matter for getting the correct instruction, whether whatever the circumstances done, case diary will have to come. Nowadays, everything comes because it is electronic filing. As soon as it is filed, the system gives notice to all concerned police officer and jail authorities everywhere it goes, and automatically the information comes. Then the other side may also come and say, we want to be heard. Sometimes it is holidays, I mean closed work days will be there. And suppose one adjournment is taken to find out whether an injury is caused, we initially court goes by only the police report. And sometimes they will wait for the medical report. Then further they may wait for the cross-exam or questioning of the doctor. Just like the recent case of the suicide at Goilon, to confirm, to find out whether it is suicide or homicide. The doctor had to be examined by the police. Even now they are in confusion. So everything will depend on the facts and circumstances of each case. We cannot put a rule which is applicable to all cases. Yes.
Thank you. Thank you so much, sir.
May I add something, sir?
Yes. Our secretary
Sir.
subjects, retired subjects, and yes, sir.
Sir, generally a public whenever a public servant is attacked, there may be assault or a criminal applying criminal force. Then adding some other offences, IPC 353 will also be there. And if hurt is caused, IPC 332 will also be there. But even if the accused is arrested at once and produced before the magistrate, there are some difficulties for the magistrates to remand him in judicial custody, because there is a general direction from our Honorable Supreme Court that if the offense is punishable up to 5 years imprisonment, then it is preferably the magistrates have to avoid remanding the accused in judicial custody. So I think there must be a general hue and cry from the public, the civil society. Then only, in order to curb these type of issues, there will be alert to the judiciary. It can be prevented by tough decisions from the part of the judiciary. Then only we can arrest the kind of this kind of happening from the wrongdoers. So if bail is granted, anticipatory bail is granted either by IMA or the victim at the initiative of the victim, I think it is better to approach the Supreme Court for cancelling that bail. Then only the problem can be solved.
Had a great discussion, and all of the speakers, the first and foremost thing highlighted was this doctor-patient relationship. And though we are against the inflated advertisement, I would like to tag the Kalyan Singh's ad, Vishwasam Adalela. The basic trust between the doctor and patient is the need of the hour, irrespective of the family doctor, specialist or super specialist. And we have a great trust in IMA, as Dr. Haroon pointed out. The Doctors Association can work more, both introspective and regarding the public side. And we have a strong belief in law and order as well. But this simply or strict law and order implementation alone will solve the issue. There are many issues. As Dr. P.K.Sasidharan pointed out, there are social aspects as well. And the current inverted pyramid should be corrected. And thank you, sir. PK sir is there to add something.
No, I just wanted to answer to one query that asked Dr. Haroon was saying there is difference between primary care doctors and family doctors. Is it so? I need to clarify that. In fact, primary care doctor, GP or family doctor it is the same thing. It is different names in different places. It's actually not different. So, but as a stopgap arrangement in India, we can choose anyone as a family doctor for your counseling. That does not mean that we are going to replace primary care doctors. Primary care means family doctors. In England, it is called general practitioner. In some places, it is called family medicine. It is the same, either primary care, family doctor, or general practitioner. All are same only. But the stopgap arrangement, you can choose anyone whom you trust as your family doctor for the advice. That is the stopgap arrangement which Dr. Haroon was referring to. Thank you.
It's not true, actually.
And thank you all speakers and audience. And your contributions are to the point and was very relevant. And as doctors, we will try to improve our relationship with doctors. And as public, we have to come up with support hospitals and doctors. And because doctors are the saviors of the public, and we have many n number of reasons, and meanwhile this current doctors have to deal the patients as the trustworthy doctors in future. If we have a great number of family physicians, we can bridge the gap between the patients and the healthcare system. Thank you all. Thank you for your participation.
Thank you very much.
Thank you, SHOM.
Thank you. Thank you.
Dr. Anandarajan.
So I think it's time to wind up. So we have Dr. Anandarajan for delivering vote of thanks. He is a general practitioner and a permanent trustee member of Social Health One Health Movement, and he is also a state secretary of IMA CGP Kerala State. Over to you, Dr. Anandarajan.
Thank you. I would like to initially thank all the participants in general, especially giving their contributions from one and all. I especially thank Dr. Today's chairperson, Dr. M.R. Rajendran sir, Dr. Shashi sir, both of SHOM family only. I also thank Dr. Haroon sir. I have already seen some of sir's videos on traffic with KSRTC or other driving habits. But sadly, what we see is that implementation, as he said, is very poor, whether it is police or other participants. So too in our medical practice. When cases are given, the follow-up and other things are left part way and no final result. Once there is no result, naturally the violence goes up, whether it is against the hospital or the doctor. Thank you, sir, for giving suggestions on your 4 pillars of management. Thank you. I also thank Dr. P.K. sir, P.K.Sasidharan sir, our own trustee, for elaborately touching upon all the various aspects of hospital violence, the reason for that, especially the marginalization and so on, and the solutions too. Only one thing I noticed that there is one small aspect that which we have not discussed, what is called equitable distribution of all the resources. We see that most of the hospitals and the doctors are concentrated mostly in city areas. And naturally the village areas, of course, Kerala is far, far better. But if we go beyond, we see that people have to travel hundreds of kilometers to reach any kind of medical service. So naturally they they go to some quack or whoever is available, and whatever they give, whether it is some powder, tablet or anything, they take it with what I'll say, some medicine, and they get, some people get relief, some don't get relief. Even then there is no question of attacking those people who give this quack medicine or whatever type of medication. Anyway, I thank you, sir, for your excellent inputs. I also thank Dr. Vineeth Raj Gopal from PGI Chandigarh. He has also summarized most of these issues and given suggestions for improvement. I also thank Dr. Dona, moderator, all our participants who have given various suggestions. Anyway, thank you all. We shall try to codify all these suggestions and inputs and try to come out with positive suggestions which can be implemented. Thank you all.
Thank you.